Are you suffering from irregular menses and infertility? Have you been recently diagnosed with PCOD? So this video is for you. Hello, my name is Dr. Sakshi Bansal, MBBS MS DNB Obs and Gynae with super specialization in IVF and infertility. In my past experience of 15 years, we have helped many patients conceive through IUI, IVF and through natural methods. In this video, I will give answers to 5 very important questions related to PCOD. So, question number 1. What is PCOD or PCOS? PCOD or PCOS stands for polycystic ovarian disease or polycystic ovarian syndrome. How is PCOD diagnosed? How does doctor diagnose PCOD? PCOD is diagnosed by 2 of 3 criteria when they are fulfilled. Number 1 criteria is oligo or anovulation. That is, you are not ovulating at a proper time. Number 2 is characteristic ultrasound pattern which is seen in of the ovaries, which is seen in ultrasound. That is, there are numerous small follicles which are located in the periphery of the ovary in a necklace-like pattern. Number 3 is clinical or biochemical signs of hyperandrogenism. That is, excess of male hormones. Now, question number 2. What are the symptoms of PCOS? Symptoms of PCOS can be varied. Number 1 most important symptom is oligo or anovulation. That is, you are not ovulating properly, so there is infertility and difficulty in conceiving. Number 2 is irregular menses. They are prolonged cycles, that is delayed cycles. At a gap of the period cycles, they can come at a gap of 2, 3 months, 4 months, 5 months, at an extremely irregular. Or they may not come at all. That is absence of menses. Number 3 is irregular off and on bleeding. Or number 4, that is spotting. It can be in any form. PCOS menses can come in any form in patients of PCOS. Then number 3 is symptoms of hyperandrogenism. That is excess of male hormones in the body, which can lead to excessive facial hair growth, acne, oily skin, and dark patches on the body, hair fall, baldness, etc. Then these patients also suffer from obesity and excessive weight gain. Number 3rd question. What is the cause or pathophysiology of PCOS? PCOS basically occurs due to increase in the production of male hormone from the ovaries, which occurs due to excessive secretion of a hormone which is called as LH, that is luteinizing hormone from the brain, which stimulates the ovaries, and hence the ovaries produce excess of male hormones or androgens. Number 4th question. Can PCOS be cured? There is no permanent cure for PCOS, but the symptoms and the problems which are associated with PCOS can be managed and treated. Number 5. What are the treatment options in patients of PCOS? Basically, the treatment depends upon the problems that the patient is facing, and we focus on those problems and treat them. So if the patient comes for infertility, then we give them medicines for ovulation. That is ovulation induction medicines, then do follicular study, and then they may conceive. This can be done by medicines or by injections. Or number 2, if the patient is coming with complaints of irregular menses and does not desire pregnancy, then we give hormones or medicines to regularize the menses. Number 3rd, if the patient is coming with symptoms of hyperandrogenism, that is excessive male hormones, then we give anti-androgenic medicines to reduce those symptoms, that is facial hair, acne, etc. But the mainstay of treatment is lifestyle management. Lifestyle management is a must. There should be a reduction in the sedentary lifestyle. There should be activeness, and exercise of at least 1 hour a day is very important in controlling the symptoms of PCOS. Also, dietary management is a must. Patients should be cautious in taking their diet, should be taking high protein diet in the plant-based form. Then there should be limited sugar intake and less of processed food, less of trans fat, whole grains should be more, and the patient should focus on weight loss. Approximately, if the patient loses even 5% of her body weight, it can lead to a drastic difference in the symptoms of PCOS. Thank you.